JW, my doc did not warn me about insulin weight gain. What can I do to stop it? You cannot. Insulin doesn't make you gain weight. What insulin does is make you hungry. You eat more and you gain weight. Now, when you're a diabetic, you're on insulin, the doctor is telling you to eat less, but he's giving you a medication, insulin, that makes you hungry and makes you eat more. That is why most people with diabetes, they lose weight when they're first diagnosed because they don't know what the problem is, that high sugar creates a catabolism or catabolic situation where your body literally is eating itself, so you lose weight. People get scared. They think they have cancer. They think they have HIV or AIDS. And so they don't want to go to the doctor to get checked. They go to the doctor, they get checked. Doctor said, oh, your blood sugar is 600. You have diabetes. And they're literally relieved that it is, quote, just diabetes. But that's a life-threatening circumstance. Now, to get out of that glucose toxicity, you would have to use insulin. But you don't necessarily have to stay on insulin. Now, there's so many treatment options available. I take people off and get people off of insulin on a regular basis. But if you have type 1 diabetes, you will need insulin. If you have burned your pancreas out, meaning you've had diabetes for more than 15 or 20 years, because it's thought that by the time you're diagnosed with diabetes, you have already had diabetes for 3 to 5 years. You just didn't know it. When you, as your pancreas is burning out and making less insulin, you need to replace that insulin. So that is why the problem is, unless you get like an insulin pump, if you're taking insulin shots, then it's going to probably result in weight gain unless you are just very, very strict about what you're eating. You have to really maintain a healthy diet. You have to make sure that your portions are low, and you have to monitor what you're eating. Since most people don't do that, you end up gaining weight. So that's what the problem is, JW. But there are things you need to talk to a nutritionist to help get your diet under control, and ask your doctor about other options besides insulin that not only won't make you gain weight, but probably will help you lose weight, like the new GLP-1s, like the Ozempics, like the Manjaros. Those medications, again, I've been successfully removing people off of insulin, put them on those drugs, get the diabetes control, lower their A1C, and they lose phenomenal amounts of weight. The weight loss with those drugs is 20 to 30 pounds per 100 pounds of weight. That is the equivalent to having had a gastric bypass surgery without the surgical risk, without the surgical recovery time, and without rewriting your plumbing permanently. That results in a whole lot of problems and side effects, particularly depending upon what you eat. So, JW, you need a partnership with your doctor. Get a nutrition consult. Doctors don't have nutritionists in their office now routinely because insurance won't pay for their services. So you'll have to get one that's affiliated maybe with the hospital, which sometimes will do nutrition counseling for diabetics for free. Or public health center as well. Public health center, federally qualified community health center, or a major hospital system. Just call and ask, do they have nutrition counseling for diabetics available for you? All right, great question.